We turn now to one particular tropical disease, Guinea worm. Experts predict that with adequate resources, the waterborne disease can be eradicated. But just how close are we to eradicating the painful disease? I spoke about that possibility via Skype with Dr. Ernesto Ruiz-Tiben of the Carter Center in Atlanta, Georgia.
Guinea worm disease is caused by a parasite. It's a long worm called Dracunculus medinensis, or Guinea worm disease. People become infected only via drinking water.
How big of a problem is it around the world?
Right now, it's a very small problem because the eradication campaign that's been going on against this disease and led by the Carter Center and other partners since 1986. We started with 20 countries, of which 16 have already eradicated the disease from the national countryside. Only 4 remain reporting cases.
Recently, Britain has announced to allocate some funds and help to eradicate Guinea worm disease. Tell us about this fund that is coming.
Britain announced a grant to the Carter Center of £20 million, which is about 1/3 of all the funding needed to complete the whole eradication campaign. And this is a matching grant, and it's contingent upon other partners providing funding.
Tell us about the latest effort in terms of total eradication.
Our time frame is to interrupt transmission of the disease everywhere by the end of next year, by the end of 2012, so that all of these countries begin to report 0 cases in 2013. So we're looking at a timeline between now and 2015 to eradicate Guinea worm disease and declare the world free of it.
Considering there is no known cure or vaccine to treat this disease, what does it entail to eradicate it?
The principal thrust of the interventions we use against Guinea worm disease is mainly to educate people about the disease, where it comes from, and what people themselves can do to prevent it. We empower people as well by providing filters free of charge to all households in endemic communities in all of the countries. In addition, we can apply a chemical to the water that's not a magic bullet, but it's very helpful in certain situations. The third approach would be to provide safe water from underground sources to those villages in those remote places. But we, the Carter Center, do not provide funding for provision of safe water because there are many organizations, the so-called water sector organizations, that are in the business of providing safe drinking water in all of these countries. And lastly, the fourth barrier to transmission is really the surveillance system that's in place in all of the villages in the endemic areas, where village volunteers report about cases of the disease. The bottom line that we're after preventing contamination of water. If this is done thoroughly, with all of the cases, all the time, in all of the villages, then we will interrupt transmission.
And that's all not a pretty sight there.
Not a pretty sight, but good news. By 2015, it might be a disease of the past.
Absolutely.
So we hope so. Thank you so much. That's Linord Moudou, joins us every Tuesday and Thursday here on In Focus with the latest health news.